Hello, everyone. My name is Kevin. Today I'll be presenting on implementation integrated therapies for individuals experiencing comorbid PTSD, anxiety, and substance use disorders within community-based substance use treatment programs. This project is based on an interview I conducted with the licensed substance use disorder counselor named Carissa, who offered valuable real-world insight. Comorbidity, or the presence of two or more conditions in one person is especially common among those dealing with PTSD, anxiety, and substance use. These overlapping disorders require a comprehensive integrated treatment approach. Community-based programs are often the first and most accessible line of support, so ensuring they are equipped with effective evidence-based strategies is essential. Barriers in integrated treatment. Barriers to effective care include stigma, lack of funding, and insufficient staff training. Many programs don't have the resources to treat mental health and addiction simultaneously. Clients often struggle with trust, trauma, and inconsistent care. Inconsistent access to care. Barriers. When I asked the counselor about these challenges, she emphasized the funding gaps prevent programs from hiring cross-trained staff. Clients also avoid trauma work due to fear or emotional overload. Highlights the importance of creating a safe, resource environment. Effective treatment models. Some of the most effective models include cognitive behavioral therapy, dialectical behavioral therapy, EMDR, and seeking safety. When paired with medication and assisted treatment, these approaches help address both trauma and cravings. Therapy, EMDR, and seeking safety. When paired with medication assisted treatment, these approaches help address both trauma and cravings. Counselor also shared that interviewing is especially helpful in building bonding early on. She also used trauma-focused CBT to help clients unpack negative beliefs and rebuild healthier thinking patterns. Peer-recovered support, she said, also adds a powerful layer of accountability. Client factors that influence outcomes. Individual outcomes depend heavily on readiness to change, support networks, and recurring physical or mental health conditions. Clients with stable housing and strong support tend to progress further in recovery. The counselor highlighted that the trust in the provider is often the make or break factor in treatment. Clients who feel heard, validated, and empowered are more likely to stay and engage in their care. Thank you. CBT helps clients reframe harmful thoughts and behaviors, while MI encourages intrinsic motivation and goal setting. These two methods are often combined to help clients both reflect and take action. CBT and MI, she emphasized how CBT addresses distorted thinking and behavior patterns and how MI reduces resistance and strengthens the client's voice in their treatment process. These are core tools in her work. Pharmacological treatment. Pharmacological supports like SSRIs for anxiety and MAT for opioid or alcohol dependence are often used alongside therapy. Coordination with prescribers ensures medication support does not replace the therapeutic process. To keep clients engaged, programs use flexible scheduling, peer mentorship, and individualized care. Making treatment feel accessible and non judgmental goes a long way. Engagement. In her experience, rapport is everything. When clients feel a connection, they're more likely to show up and keep showing up. She also relies heavily on peer specialists to create relatable support systems. On a larger scale, we need policy changes expanding Medicaid, funding trauma training, and incentivizing cross-discipline collaboration. Without these supports, integrated treatments can't scale. Council believes that the trauma-informed care should be standard across all programs. More grants and continuing education funds would allow providers to build the skills they need to serve complex clients. Integrated treatment works best when it treats the whole person, mental health, trauma, addiction, and environment. With funding, flexibility, and the right training, community programs can transform lives. Here are the sources I used, including the DSM-5, the MHSA toolkit, and personal communication for my interview with a licensed C counselor. Thank you so much for listening to my presentation. Yeah.